is dreaming about getting spanked by your wife.
Well, that's not so unusual.
Bill, you get your arm off me!
Mental illness is something that is much more common than people think. About 25% of Americans over the age of 18 suffer from a mental disorder. These include anxiety disorders, mood disorders, psychotic disorders, personality disorders, eating disorders, ADHD, and autism. Today, we are going to look into the mental illness of Bill Dautrieve. Bill is a 42-year-old white male. He lives in Arlen, Texas, but is from an upper-class family from New Orleans. He has one living relative left, which is his cousin. In high school, Bill was a popular kid and a high school football star. He was nicknamed the Bill Dozer and even held the school touchdown record. He enlisted in the Army before graduation and is currently a sergeant barber in the U.S. Army. He is neither rich nor poor. Bill met the love of his life, Lenore, at a concert. They were married, and she cheated on him, resulting in a divorce. This is when his depressive symptoms began. The depression lasted since the divorce happened, about 7 years ago. Bill is depressed nearly all the time. Even his friends describe him as being depressed. He often talks of his ex-wife and still loving her. Bill often states that nobody will ever love him again. He also overeats, has very low self-esteem, and does not take care of himself.
Why do you keep calling me Bill? My name is Lenore. Silly, I've come back because I love Bill so much, and I really missed him.
Bill is certainly suffering from a mood disorder. A mood disorder is a disturbance of the mood that is intense and persistent enough to be a problem in everyday functioning. There are two types of mood disorders. The first is unipolar disorders. This is where a person suffers from severe depression. The second is bipolar. This is where a person suffers from both depressive and manic episodes. Bill does not have any manic episodes, therefore he has a unipolar disorder. More specifically, Bill suffers from dysthymia. Dysthymia is a form of long-term depression. It cannot be diagnosed until the depressive state has lasted for at least 2 years. According to the Diagnostic and Statistical Manual criteria for dysthymia, Bill matches perfectly. The first criteria for dysthymia is a depressed mood for most of the day, almost every day, for 2 years. Bill has been depressed for nearly 7 years. This is reported by him and his friends.
Not in the sandbox.
Relax, Hank. Studies show that your average sandbox is only 30% sand. The rest is a melange of urine, feces, animal feces, and etc.
Bill, I want you to stand downwind of me and tell me what you hope to accomplish by stealing this tank. I don't know. I was in the base. I was drunk. I couldn't find my car keys. Look at me. Look at what they did to me.
Did they take your clothes?
No, but they took everything else. When I first enlisted, I had the body of an all-city offensive lineman and hair like Roger Daltrey. I signed up for the armored division. I wanted to be a tank driver. Oh yeah, I had the confidence of a man with a washboard stomach and a smooth back. And then they started giving me my super vitamin shots. Now look at me. I'm a big fat pant load throwing up in the sandbox. I know you're disappointed with the way you turned out. We all are. But the good news is it's not your fault. All those things that were great about you back in high school, the confidence, the charm, the pep, they're still part of you. They're just hidden inside the government's bloated, lazy body. What? So, it's not my fault that I'm fat, bald, and lazy?
Or that your breath always stinks like rotting garbage?
My breath smells? It doesn't smell pleasant most of the time. Why didn't you guys ever say anything? Well, we didn't tell you because it would have hurt your feelings, but now that we know it's the government's fault, well, your breath stinks.
The second criteria for dysthymia is the presence of 2 or more of the following symptoms: poor appetite or overeating, insomnia or hypersomnia, low energy or fatigue, low self-esteem, poor concentration or difficulty making decisions, and feelings of hopelessness. Bill experiences overeating, low energy, low self-esteem, feelings of hopelessness, and difficulty making decisions. More frequently than not, Bill's depressive symptoms will lead him to overeating, which leads to even lower self-esteem. Bill's best friend Hank usually makes all his decisions for him, as Bill has difficulty doing this for himself. The third criteria for dysthymia is that during the 2-year period of experiencing these symptoms, the person has never been without the first criteria for more than 2 months. Bill is depressed nearly all the time. He never reaches the 2-month window. There are a few periods of short normalcy, but he is right back to being depressed shortly after. The fourth criteria for dysthymia is no major depressive episode is present during the first 2 years of symptoms. Bill's depression has lasted for 7 years. Major depressive disorder usually does not last that long. Therefore, dysthymic disorder is a more proper diagnosis for Bill. The fifth criteria for dysthymia is that there has never been a manic episode, a mixed manic episode, a hypomanic episode, and symptoms do not match cyclothymic disorder. Bill has never experienced a manic episode of any type, and his symptoms do not match cyclothymic disorder. The sixth criteria for dysthymia requires that the disturbance in mood does not have to do with a psychotic disorder. Bill shows no symptoms of a psychotic disorder. The seventh criteria requires that the symptoms are not due to a physiological effect of a substance. Bill has no substance use problems. Before his disorder, he was happy and popular and very content with his life. He will partake in a beer in the alley with his friends, but normally just one a day. He does drink during severe bouts of his depression, but this is due to his depression, not due to alcohol dependence. The eighth criteria for dysthymia requires that the symptoms cause distress in everyday life. Due to his illness, Bill needs to feel needed. When he is feeling needed by somebody, he usually drops every aspect in his life for a short period of time. This has caused trouble with him at work and financially. Bill also has low self-esteem and does not take care of himself. This leads to impairment in forming new relationships. He is often rejected when trying to make new friends, therefore he does not try very often. As you can see, Bill meets all the criteria for dysthymia disorder. Now it's time to look into his treatment.
Sorry, sir, but you have more food than money.
Okay, now I don't need cling wrap. This is my whole Thanksgiving dinner, and who am I kidding? There aren't going to be any leftovers.
You're still over?
But you can't taste my turkey.
Still over.
Huh?
Dysthymic disorder, much like all mental disorders, is very serious and needs to be treated before it gets out of control. Unfortunately for Bill, dysthymia has not been studied very much. This makes the treatment of Bill's disorder much more difficult. Most therapists treat dysthymia like they would treat major depressive disorder, since dysthymia is considered to be a milder form of major depressive disorder. The first step in Bill's treatment would be an antidepressant. Once the appropriate dosage has been found and Bill has gotten used to his medication, he could begin to undergo psychotherapy. A family member would be ideal to go with Bill to his therapy sessions, but since he does not have any close family, one of his friends should go with him. The therapy sessions can be used to educate Bill and his friends on his disorder. It would give himself and his friends important information to help Bill cope with his disorder and assist him through times when he is very depressed. It would also educate his friends not to say hurtful things to Bill, even if they only mean it as a joke. It would teach Bill that not every bad thing that happens is worth getting depressed over and would teach him to let go of certain things. Bill also needs therapy to get over his divorce and self-esteem issues. Once psychotherapy has been completed, a therapist could use cognitive therapy to change how he views things. This would help change his views from pessimistic to more optimistic, which would lead to greater overall happiness. It would also be recommended that Bill find a hobby, besides cutting hair, to fill his free time with. It would also be recommended that Bill seek the help of a dietitian to learn what to eat and how to prepare healthy meals for himself. This will lead to a healthier Bill, which will raise his self-esteem. Bill would need extensive therapy and the support of his friends to fully overcome his disorder. This could take many years, and Bill needs to understand that it is a gradual process that will not happen quickly. Mental illness is a major problem, and through education of mental disorders, the understanding that just because somebody has a mental disorder, they are not crazy, and healthy support systems, it is very possible for people diagnosed with mental disorders to live a normal, happy life. This is the goal of clinical psychologists all across the world. That's all the time we have today. Tune in next time for more diagnoses and information on mental disorders.